Good morning, my name's Dr. Adam. I'm one of the sports doctors here at Aspetar Sports and Orthopedic Hospital in Doha, Qatar. For the last 2 years I was the chief tournament physician of the ATP Doha Open tournament held here in Doha. And this morning, together with my friend Mike, we're going to be talking about shoulder pain in tennis players. Shoulder pain in tennis players is one of the most common problems that tennis players face. There are three major causes of shoulder pain in tennis players. One, a poor technique in service. The service is one of the most important shots in tennis, and having a poor technique really increases your risk of developing shoulder pain. The second one is a lack of strength in the muscles behind the shoulder. And the third one is a lack of flexibility of the capsule at the back of the shoulder. And these are the things we must address if we want to prevent and treat this injury properly. The pain in the shoulder happens when the tendon on the top of the arm bone gets pressed against the bone here while moving. So when the arm is coming up to serve, if it's getting stuck here, this will cause the pain. This can happen with serving if the player doesn't bend the knees enough, if they're not rotating the pelvis when they're preparing for the serve, if they're not dropping the shoulder as they throw the ball up, and if they go too far backwards with the arm during serving. This can all lead to the problem. Weakness of the muscles at the back of the shoulder lets the shoulder blade move forward and reduces the space here. And the tight capsule across the back of the shoulder also leads to a lessening of the space, which pinches the tendon more. So these are the major causes of shoulder pain in tennis players. When we're treating players with shoulder pain, one of the most important things is to sort out the technique, help to correct their technique. So this means when they're preparing for the service, we have to make sure to bend the knees enough as they come up, prepare for the ball. Check with the coach they're bending the knees. At the same time as they're throwing up the ball, make sure to drop the shoulder so that the shoulder's coming down. And as they extend the arm, make sure they don't overextend the shoulder, because this will also cause shoulder pain. So the movement should have a knee bend, rotate the pelvis, tip the shoulder, and then come through. And if you sort out the technique, this will help them a lot with the pain. Part of the treatment for the tennis player with shoulder pain is to strengthen the muscles behind the shoulder. And we can do that using weights, by lifting the weights to work the muscles at the back of the shoulder. And we can also use elastic bands to strengthen the muscles at the back. And keep going until you feel the muscles behind the shoulder are really tired. Tennis players with shoulder pain should also stretch their shoulder before and especially after they've finished playing or training. And with your other hand, you move the shoulder down until you feel a stretch across the back of the shoulder, and then you hold this for 20 to 30 seconds. We all know that prevention is better than cure, and here at Aspetar we have the ASPREV program, which is dedicated to preventing illness and injury in athletes. As a tennis player, to help prevent developing shoulder pain, we should focus on the same three things we talked about in the treatment section. Firstly, make sure you have a good technique in your service. Secondly, make sure that you strengthen the muscles at the back of the shoulder. And thirdly, do the stretches to make sure that the capsule at the back of the shoulder is flexible. If we do these three things, then we should be able to help our tennis players not develop shoulder pain. This has been Dr. Adam speaking to you from Aspetar Hospital this morning. It's been a pleasure, and I hope to see you next time. So we all know the saying, prevention is better than cure. And here at Aspetar Hospital, we're also specialized in preventing sports injuries. We have the ASPREV Sports Injury Prevention Program. And for a tennis player, to prevent yourself getting shoulder pain, the same three things are important. Firstly, concentrate on your technique. Secondly, do strength exercises to make sure that the muscles at the back of the shoulder are strong enough. And thirdly, do the stretching exercises to keep the back of the shoulder flexible. If we do these three things, we should be able to prevent the shoulder pain from affecting our tennis players. This was Dr. Adam Weir speaking to you from Aspetar Sports Medicine Hospital. And if you're out there and you're a sportsman or woman with an injury problem or a question, we'd be more than happy to see you here at Aspetar Hospital. Thank you. See you again next time.